Hi, I'm Molly Hendrickson. Welcome to Renew. Whether you have a denture or you're losing all your teeth for the first time, the Renew doctors know what you want: a beautiful smile and to chew like a 20-year-old. Well, today we're going to have an informative discussion comparing the options when a patient is getting full mouth teeth replacement with dental implants. We want you to have the information you need to make an educated decision that is right for you before you start your journey. Joining me today is a panel of dental and medical professionals to discuss a patient's treatment options for teeth supported by dental implants. Let's start the discussion with Dr. William Balanoff. Thank you so much for joining us.
I'm glad to be here. Thank you for having me.
Dr. Balanoff is the Chief Clinical Officer for Renew. He graduated from Northwestern University and received his postdoctoral master's in craniofacial research with an emphasis on prosthodontics. Dr. Balanoff is published and has numerous national and international patents. He has been an adjunct professor at several universities in the U.S. Dr. Balanoff's research on Tourette's syndrome was featured on CBS's The Doctor Show. He has provided implant dentistry for patients worldwide since 1986. Dr. Balanoff also produces mouth guards for many of the teams of the NFL, NBA, NHL, and MLB. So Dr. Balanoff, when it comes to teeth supported by implants, I'm sure there are a lot of variations, but what are the two most popular choices?
False teeth supported by dental implants allow you to eat anything you want, and it'll give you a $1 million smile. False teeth are false teeth. There are two popular ways to correct this condition: fixed, non-removable false teeth and fixed, removable false teeth. Fixed, non-removable teeth are almost impossible to clean because the patient cannot take them out. Only a dentist can. Fixed, removable false teeth are easy to clean and maintain because the patient can take them out whenever they want. Don't get me wrong, both fixed non-removable and fixed removable teeth are amazing options, but the fixed removable have more advantages, starting with cost. Fixed non-removable teeth typically cost between $42,000 and $87,000. Fixed removable teeth cost between $15,000 and $25,000. Also, the aftercare, or the maintenance for fixed non-removable teeth, is incredibly expensive and can be out of reach for many patients.
Yeah, when you hear those numbers, you can see that incredible cost difference. Dr. Balanoff, can you explain a little more about fixed removable teeth supported by dental implants?
Molly, everyone wants to look amazing. Imagine eating anything you want, biting into an apple, eating popcorn at the movies, ordering something other than super pasta at a restaurant. Your new teeth will allow you to renew your life.
Okay, now you've got me hungry, but it truly is amazing. You get the same chewing ability and smile from both solutions, but the cost is dramatically different. Can you discuss the maintenance and aftercare cost of teeth supported by dental implants?
It's important that patients know what the cost of aftercare is going forward. Fixed, non-removable teeth, very difficult to clean, very expensive to maintain, and typically cost between $600 and $900 per hygiene visit, and you've got to do it 3 times a year. That's almost $3,000 per year to maintain the fixed, non-removable false teeth. The bacteria and food trapped underneath the teeth, it's horrible. There is no way for all the bacteria inside your mouth to be good for your overall health. On the other hand, fixed removable teeth, very easy to clean, inexpensive to maintain, and typically cost $100 per hygiene visit, and that's twice a year. So that's about $200 per year to maintain fixed removable false teeth supported by dental implants. For all of these reasons, I only recommend fixed removable teeth.
So now I understand, as a consumer, the wrong choice can be very significant and an incredible financial burden for almost all patients. The aftercare maintenance cost needs to be very affordable for everyone. Dr. Balanoff, as a consumer, I was always told to get a second opinion, so who do you recommend?
Molly, I love second opinions. It just makes sense. I think if we can get a second opinion from the former president of the American Dental Association, that would be a pretty good second opinion. Molly, if you can please introduce Dr. Maxine Feinberg.
That's a great idea, Dr. Balanoff. Periodontist Dr. Maxine Feinberg graduated from New York University and the NYU College of Dentistry. In 2015, she was installed as president of the American Dental Association. Dr. Feinberg was the first woman to serve as president of the New Jersey Dental Association and has practiced in New Jersey for 37 years. She is on Renew's Clinical Advisory Board. Dr. Feinberg, welcome. It's so nice to have you here with us.
Well, I'm so glad to be with you today, Molly.
So we just heard Dr. Balanoff's opinion. Which solution would you recommend for people who have dentures or are losing all their teeth for the first time?
I strongly recommend fixed removable false teeth. And here's why. Only a licensed professional can remove the fixed non-removable false teeth, and that can be very expensive. Most patients cannot clean effectively under fixed non-removable teeth themselves. It's just a fact. When I or any other dental professional remove fixed non-removable teeth, the odor can be very unpleasant. The bacteria embedded under the teeth can create many problems, such as gum disease around the implants, and also bacteria get into the body, and this increases the chance of actually losing the dental implants. Let's look at some pictures of what it looks like under the fixed non-removable false teeth.
Dr. Feinberg, seems like a smelly mouth, bad breath. That's going to be kind of a romance killer. Any romance will go right out the window with the way fixed non-removable false teeth smell.
You're right, Molly. I hear this from my patients all the time.
Well, thank you so much. This has been very educational. Now, earlier today, Dr. Balanoff discussed a medical procedure with a dental component. I understand eating like a 20-year-old and a beautiful smile, but now let's discuss the medicine portion of the Renew procedure for a fixed removable smile with Dr. Bernard Shays. Dr. Shays, thanks for joining us.
My pleasure.
Dr. Bernard Shays received his MD from the University of Bucharest. He completed his residency in internal medicine at Nassau County Medical Center in New York. With more than 30 years in private practice, Dr. Shays focuses on lifestyle management, wellness, and anti-aging. He has treated thousands of patients with a wide range of chronic health conditions. As Renew's Chief Medical Officer, Dr. Shays is in charge of patients' medical health and medical clearances. Dr. Shays, why is it necessary to have a Chief Medical Officer?
I agree with Dr. Balanoff. This is a medical procedure with a dental component. Here at Renew, we treat people, not just teeth. The reason why it is a medical procedure is because the oral cavity is the pathway to overall health. With proper medical guidance, by getting a complete and very thorough medical evaluation, we have a much higher probability of a successful outcome, such as reducing possible dental implant failure, and most importantly, no adverse events from anesthesia. We want all our patients to have complete success in their overall dental health.
And just to be clear, the Renew procedure can actually make a patient healthier.
Yes, because good oral health can lead to better overall health. And I want everyone to know that Renew has a full-time anesthesiologist, Dr. Leslie Ojeda, that I've worked with for over 20 years. She makes certain that your IV sedation is customized for your safety, and that is a very big part of the medical component.
Well, thank you so much, Dr. Shays. If anyone wants more information on this subject, check out Renew's other videos on this topic. It is very clear and transparent that our panel of experts has educated and discussed with us why fixed removable false teeth are a better value than fixed non-removable teeth. Both will allow you to eat anything you want and give you $1 million smile. But there are three really big differences. Fixed removable teeth are a lot less expensive. Fixed removable teeth are easier to clean. And finally, they're a lot less expensive to maintain over the course of your lifetime. This is a big decision. We hope we helped you. It starts with transparent education. We discuss the difference in false teeth, maintenance, and cost. The next step of your journey to a beautiful smile and better health is to come in for a free initial consultation or second opinion. During that visit, you'll also get a free CAT scan, which is valued at $750. At Renew, the team treats people, not just teeth. So when you're ready, be sure to visit renewsmiles.com for more information. Remember, at Renew, we treat people, not just teeth.